Anyway, joining us now, State Senator, Republican Henrico, State Senator Dr. Siobhan Dunnavent. Senator Dunnavent, always great to have you on early because I know you've got patients to attend to at the bottom of the hour. So thanks for making time for us.
Thank you so much for having me on, John. I'm really always happy to be here.
Siobhan, lots to talk about today. Let's start with this special session that you're involved in. Does it just go on until January? I mean, will it ever end?
I have no idea, and it's extraordinarily frustrating because the schedule keeps changing. I am so honored to serve the 12th District in the legislature and be there, but it's completely unpredictable. I have patients that have made appointments 6 months ago. And for instance, last week, 2 weeks ago, they told us we're going to be here Wednesday, Thursday, Friday, every week until we're done. Okay. I went and I adjusted my schedule and adapted to that. By the end of the week last week, they said, first, we're not coming next week. Then they said, we are coming next week, but we're going to come Tuesday and Wednesday instead. So I'm going to say this. They are not running the schedule like a working mother would. We run a very tight calendar, and we give everybody a lot of lead time. And but it's very hard to have attendance when people are coming from all across the state when nobody knows when they have to be there. And this is a citizen legislature. We are not full-time politicians. I don't want to be. I really want to be a doctor that takes what I learned from my patients to the legislature to inform decisions, but they're not making that easy.
Are these decisions coming from the state Senate Democratic leadership, or are they driven by the House caucus of the corn?
It's a little bit of the same. I mean, right now we have completed our Senate work. And so we are waiting for both our finance committee to do the budget and also to get all of the bills out of the House. And so we have to respond to what they do, and we can't respond until they send it to us. But ultimately, our leadership can decide how we respond. And, there should be a way to be able to clump this together and efficiently perform the services that are necessary for the state. But honestly, if you think about how much money this costs every day, when we go in there and we talk about 3 bills, this is a lot of money for the state for, this disorder.
I've been covering this for a decade, and normally you have a special session. It's tight. It's a couple of days. Mm-hmm. You have the veto session, and then maybe you have one called in the summer for a budget crisis or something of that nature. You fix it, you go home. But now, there's no end in sight. And it seems like the House, and led by, I make fun of it because it kind of fits Eileen and the caucus of the corn and the hard left over there. It seems like they're just taking an opportunity to draw up bill after bill after bill and smash it through. None of them are getting any bipartisan support at all. There's no teamwork going on. It's just bash these things through. And then the state Senate has to deal with it. Like last night, tell me about last night. All the Republicans voted in opposition to the new bill in the Senate that passed, setting up these citizen review boards. All the Republicans voted no. And some of the speeches I saw last night from like Senator Bill DeStefan comes to mind were very passionate. A lot of Republicans upset over that. Why?
Well, I think that I think the really frustrating part is that the public conversation about what we might agree on and what needs to be done is not what is being put into the bills. And instead, the bills have sort of an inherent undercurrent of suspicion and disregard for police. And it's very, very frustrating to hear this glossy representation. We need to do something to improve accountability, but to see that these review boards actually take the review process out of the police department where the subject matter experts are, put it on a citizen review panel who may or may not have any subject matter expertise. I can tell you this much. Nobody from the police is allowed to be on that civilian review panel. They're going to review the actions of the police and then direct both the police officer and the division what the actions will be. And those are binding. Those are binding decisions. These panels have subpoena ability. It's one thing to say that a public advisory committee would contribute to improved relations and mutual understanding between the police department and the public. And that I think that's a fair statement. But these review panels that they are implementing or suggesting localities implement really are not appropriate. I was on the Board of Medicine for years. Mm-hmm. We reviewed doctors that had decisions that were questioned by complaints by the public. Mm-hmm. And we were the intersection between the public's concerns and what professional review decided. You can't really have, I don't think there's anybody that has a job that wants somebody who knows nothing about their job evaluating how they do it. Mm-hmm. And police have a very specific set of competencies and training, and so they should be reviewed within. And what they're proposing, and then the Democrats, honestly, they dismiss the deep-seated concerns of what these panels are going to do to destroy the sense of confidence that police have in this career. And they say, oh, don't worry about it. This is going to be okay. This is a quote from the floor last night. This is an okay thing to do. It's an okay thing to do. That is staggering to me. The legislature should be extremely concerned about every action that they take and every possible unintended side effect. And they just keep passing legislation that has terrible jeopardy, wrapped unceremoniously in mistruths that are overly positive, seeming like they're responding to people's concerns. And it's hurting us. We've already had a lot of retirements in the police department, people who are leaving. And nobody's going to wonder, how are you as a police officer going to have any confidence in your ability to make a decision and be judged by people who understand what it took to make that decision when you know you have a civilian review board that's going to determine your future? It's just wrong.
Well, I got a text here from Jeremy in Chesapeake. We're with State Senator Republican from Henrico, Siobhan Dunnavent. Dr. Dunnavent, also pediatrician. She's delivered, I don't know, how many babies have you delivered? Like 20,000 or some enormous number, some big number.
About 2,500, I think.
2,500. Okay, so Jeremy in Chesapeake says the review board sounds like John Q. Public making battlefield decisions in a war zone. I think he's right, because I think that's basically what you're saying, that you have these review boards and people don't have really any expertise for police work, and how does that going to get reconciled? But it seems like there's just a lot of politics going into this thing. Speaking of politics, Senator Dunnavent, I want to shift gears now to opening up of public schools. Schools still closed, no end in sight. The Zoom thing is becoming a disaster. They're getting hacked into. We had an issue in Loudoun County where pornography got streamed for 20 seconds, and you've got children watching that. I talked to a client of mine yesterday. She has 3 children in school, elementary, middle school, high school, and 2 toddlers at home. And she also works, and she's got 5 children. She's got every computer going. What kind of an education can kids obtain in this environment, and what's the pathway to get them back in school?
Well, I tell you, I cannot count the ways that this is so bad for Virginia, so bad for our children, so bad for families, so bad for our economy. And I will tell you that the stark contrast that we're going to see is that places like Hanover and all of the private schools are open and they're doing great. And the assertions that the end of the world would come if we open schools will be completely disproved. And I think that I can't tell you, every single day in the office, I have moms and many moms who are teachers come in. I had a 2nd grade teacher talking yesterday about how abysmal the competencies were going to be for reading for these kids. And you've got to be reading by the 3rd grade on grade level in order to have a likelihood of graduating high school and being a part of, the economy and feeling success in your life. And so the parents, there's been no adaptation. If you take a degree online program, you do not sit in front of a computer for 8 hours a day, and you're an adult. There's an adaptation of how school happens when it happens in another through another media. And so these kids are literally in front of 7-year-old kids are in front of a computer for 7 hours a day. They can't do it. And actually, it's not healthy. It's very clear how long your kids' medical data shows how limited the time in front of a flat screen should be for your kids for how their brain functions. So this is, I just don't have the words to express how devastating it is. And I don't know. I saw that Chesterfield is going to start bringing kids back in school at the end of September with individual education plans or IEPs, but I don't know. I don't know what's going to happen. No guidelines. Nothing has been clarified. I think localities are struggling to figure out what to do. They're now caught in a battle between a polarizing teacher union organization and the rest of the teachers who feel like they can't say anything, and the parents who have had to find other adaptations. I think public education is going to completely change, John. Not as many people are going to be in public education, which may be good, but it's also going to affect what money they have. And if they don't adapt and modify public education, it's not going to be a good investment.
Senator Dunnavent, what is your solution? If somebody came to you and said, what do we have to do to fix this? What would you recommend, Senator?
I would, well, first of all, we had several pieces of legislation to provide things like liability coverage, and there are some additional liability coverages for schools for funding. I think that there's funding that could help the schools get back access to PPE that was inexpensive. But I think the number one thing that has to happen is that we need leadership, and we can't seem to do it from the legislature, and the governor isn't doing it. Somebody needs to say we need to go back to school. The parents are saying it, very mobilized parent activist groups, but we just, we have had nothing but murkiness from the state about how to do it. We've had no statement from the state that it should be done. Never has the governor or Department of Education come back and said, this is really important for our schools. We need you to open. I get a lot of people saying, we want this. I want this too. When I call them on the phone, I want this, but they're not doing it. So, I think we need leadership. That's what we need. The science is there. Look, there is no argument that schools cannot be open based on science. Right. There's none of the data supports that. That's why it's so hard to fight this battle. I can't use reason. It's the most frustrating thing at the legislature. I can't use data and reason, in debate because it doesn't influence the outcome.
Exactly. Because it's politics. That's all this is. And kids are being used as political pawns in a fight between the unions and the strategy to beat Trump. And I hate to bring it back to him, but I've been saying it for months. The strategy to beat Trump nationally is keep kids at home, can't get as many jobs, keep the economy down. So basically children get robbed of their education in order for Democrats to grab power. It's a sick thing, and that's why there's no leadership. That's why it's so politicized. And I'm sure that November 3rd or 5th or 10th or whenever we have the outcome, these kind of things will change. I want to stay with COVID and what you said, science and data. And the CDC 2 weeks ago came out with a number that the legacy fake news media refuses to pick up because it is counter to their narrative of fear-mongering over COVID and keeping schools closed, no football, things of that nature. But they came out with a number, and the number was 9,200. And the 9,200 represented people in America who have died from COVID-19 that did not have other underlying health morbidities. like something else was wrong with them. Over 85 have emphysema, pneumonia, whatever problems you had. So there were only 9,200 people that actually died from COVID without something else contributing to it. Now we have 330 million people in America. So, you do the math, it's 28 out of every million people, which is, it's under regular influenza. When you look at that number as a doctor and as a scientist, what does that mean to you?
It means that as somebody who's pivoted as a doctor and a scientist to have a seat at the table for public policy decision making, that I want to scream at how frustrated I am. And because I feel like science is being politicized. I feel like scientists that want to contradict the narrative are being suppressed. And, I will send you this, John. I will send you by email, but I was sent this weekend a YouTube video. It's a little long and it's a little wonky. I like science, so I really enjoyed it. But it is an analysis that is a perspective that for the first time completely in my medical brain explains the numbers and the curves that we've been seeing in this event. And it's done by an engineer, not a doctor. But what he's done is he's taken the data that we've collected over decades, and he's looked at what the infection and death rate is associated with every viral episode that we have, whether it's flu or swine flu or other things. And there's a pattern to this. Science is not arbitrary. Or let me say this. The world is not arbitrary. And what happens in, the ecosystems of the world is not arbitrary. There are patterns to that, and there are patterns to virus. And this virus has exactly followed the same pattern of every other viral event we've had with the same curves. The reason America is seeing a little small curve now based on this data and reflection is that based on different climates, the virus presents at different times and with different severity in how many people it infects. And Northeast America had a spike that was very similar to the typical curve we see for viral events in Europe. Mm-hmm. And the Southwest is seeing those that we typically see in the southern continents. Mm-hmm. And so it's a fascinating piece of data. It explains why the tests are positive now, even though there aren't really very many sick people, especially in Virginia, where we are only using 19 to 20% of the ventilators in the entire state. We don't have people that are at a significant level in the hospital. And so it's fascinating, but all of that is not being discussed. If you're really a scientist, you want to take the best data and look at explaining things in a way that is supported by all the other data you can collect. That's what this conversation does, and that's what we're not doing and what is not being published in the press. And the result is manipulation out of fear that is wrought by misinformation. It's terrible. There's a cost to anxiety, and what's happening to me, in my opinion, is really unconscionable. To me, this is unconscionable.
Senator Siobhan Dunnavent, Republican, Henrico State Senator, Virginia. Dr. Dunnavent, I want to thank you for your time and your candor today. I can sense and feel your frustration. As you know, I'm a big fan of your work. And I just got to tell you, hang in there. We need your leadership, as frustrating as it is. We need you there. We need your leadership, and we need your advocacy. And thanks for being with us today, Senator.
Thanks